I'm going to do my hand hygiene.
Come in.
Hi, I'm Haley. I'm going to be your student nurse today. Can you just confirm with me your name and date of birth?
Zach Brissett, May 10th, 2000.
Okay. So before we get started, I just want to make sure it's okay if I video this assessment.
Yeah.
Okay. So are you having any hearing issues?
Nope.
Any smell or taste loss?
Nope.
Any trouble swallowing?
Nope.
Okay, so I'm just going to start with looking at your ears. I would be looking face on, but because for the video, I'm just going to... Okay, so ears are symmetric, skin color matches ethnicity with no lesions. Now I'm just going to feel your ears, so let me know if you have any pain. Any pain?
Nope.
Okay, no tenderness upon palpation, and no piercings. Now I'm going to perform hearing exams. There's 3 different exams. First one's going to be the whisper test, so I'm going to have you cover your left ear, and I'm going to whisper a 2-syllable word, and you can just tell me what that word is.
Regis.
Yep.
Flower.
Yeah. Okay, now I'm going to do the Weber test with the tuning fork. Obviously this isn't a tuning fork, so I'm just going to use regular fork. So I'm going to hit it once off my palm and put it on the top of your head, and then you tell me when you don't hear it anymore.
I don't hear it anymore.
Okay. Now I'm going to do the Rene test with the tuning fork. So I am going to just do it on one side of your ear, but normally I would do it bilaterally. I'm going to hit it off my palm once and then put it on your mastoid process, and you tell me when you don't hear it, and then I'm going to move it away and you tell me when you don't hear it. Okay?
I don't hear it.
Okay?
I don't hear it.
Okay. So, hearing tone is equal in bilateral ears. His ratio is 1 to 2. His cranial nerve 8 is intact. Now I'm going to examine your external ear canal. I would be doing it with an oscilloscope, but I don't have that, so we're just going to pretend this is that. Okay. Ooh. Now I'm going to go a little deeper. Okay. So external ear canal with cilia is present. There's a minimal cerebrum observed. I'm just going to pull your ear up. Look. Seriously. Okay. Now I'm going to examine the internal ear. So I'm just going to do that again. Okay. So the tympanic membrane is pearly gray, cone of light noted by the malleus. Now I'm going to move on to your nose. So first I'm just going to look at your nose. Okay. And can you look up for me so I can look at your nostrils? Okay. So the nose is midline, the right nostril flares, the left nostril flares, and there are no lesions or drainage. Now I'm just going to feel your nose. Can you please stop doing that?
Oh.
Let me know if you have any pain.
No, no pain.
Okay. So denies tenderness, no masses. Now, we're just going to assess your cranial nerve 1, which is the olfactory nerve, and I would use 2 different scents, and he would cover his eyes in one nostril and smell it and tell me what scent it is, and we do it on both nostrils, but we're just going to pass that for this exam. Now I'm going to move on to the mouth and the pharynx, so I'm just going to again take a look at your lips for any lesions. Okay. Can you do this? And this. Okay. Can you open up your mouth so I can take a look? Keep your tongue in your mouth. And then lift your tongue up. Okay. So, lips are dry but intact. There's no foul odor. The gingiva is pink and red. All teeth intact. Buccal mucosa pink and moist. Parotoid glands visualized in the upper cheeks, lateral to the molars. The cranial nerves are intact. The frenulum pharynx is without lesions, and the tonsils are between the pillars +2 bilaterally. That concludes this assessment for today.